It is Thursday, July 2nd. Wat Kahnawake Zuguego, Joe Delronio Jets. Welcome to our COVID-19 Task Force Daily Update. This is episode 105, and on today's program we'll have the week in review, and that'll be taken care of by Arnold Lazare. But we'd like to start things off with the Executive Director of the Kahnawake Memorial Hospital Centre, Lisa Westaway.
Thank you. Very quick update today. First, just a couple of announcements. A reminder of the drop-off for inpatient, which will be Sunday from 10 to 1. Also, just a reminder that you probably have received today or will be receiving phone calls to book appointments for visitation in inpatient. That as well is being organized, and as mentioned yesterday, the visits will be done in a more personal way, taking into consideration your comments, and therefore at a closer distance, but of course with a few more safety precautions in place, and that'll be explained to you at the phone calls. Just a quick update today about our health check results. So I finally do have some health check results, and I would like to give them to you in comparison to the last health check as well. So as we had mentioned, it was a little bit more difficult to reach out to people this time around, probably due to the return to work, but our staff did change their hours in order to be able to reach out to you. So we reached 630 different households. So that's about 1,500 people in comparison to the last time where we had 820 households and close to 2,000 people. So it's still a very significant number, and the information that we're able to derive from the health check is reliable and representative of the community. So we're very pleased with these results as well. So what we saw in comparison to May, so for the basic question, are you or anyone in your household unwell at this time? Basically, in May, 93% of participants stated that they were feeling well, in comparison to the June health check, where over 99% of participants stated that they and those living in their household were well. Also, very similarly with regards to whether people had any of the symptoms related to COVID-19. If you recall, about early in April, our PR communications team did a really great online survey about the task force, and in that survey there were questions about symptoms. At that point, 79% of our community members who responded stated that they did not have any COVID-19 related symptoms. In May, at the health check in May, 89% stated that they did not have any COVID related symptoms. And in June, at this most recent health check, 99% of community members who responded stated that they did not have COVID-19 related symptoms. So we see that over the 3 months, there was a decrease every month of 10% of people who stated that they did not have symptoms. So this really represents what we're seeing in the community in terms of test results and in terms of number of people being tested. It's all very relevant and is pertinent to our analysis about how we move forward and how we make decisions about reopening the economy or changing our visitation as well. So it's very positive news. There were about 56 people who were tested from the last health check, between the last health check and this one. Not all increased because of the calls. So really, as a result of calls, we had very few people who did not recognize their symptoms and were asked to come in for testing. But we've had 56 people since. And again, as you know, it's been quite a while since we've had any active cases in the community, and any of the tests that we've done very recently have all been negative. So just a few demographics. In the first health check, 82% of respondents were adults, 18% children, compared to 83% adults and 17% children this time. And the average age in both health checks was about 52 years old, although there was a slight increase this time from the first health check. I guess overall, the most basic information to take with us is that decrease in number of people who express having COVID-related symptoms. There still was a large number of the community that stated that they were unsure if they had COVID-related symptoms or not, and that's something that I wanted to talk a little bit about today. As a reminder, COVID-related symptoms are really fever, cough or a new cough, difficulty breathing, could be sore throat, lack of taste or smell, headache, vomiting, diarrhea, so gastro symptoms. If you are unsure, we really do urge you to contact the testing site and be assessed by our wonderful staff, and then to have a test done if they make that suggestion and if it's pertinent, because the more we test when we have symptoms, the more we're able to contain the virus within the community if we do have cases of COVID-19. So it's part of our, it's really part of the hallmark in controlling what's going to happen over the next few months, along with our hygiene and our hygiene etiquette and our physical distancing. So I'd just like to thank you all very much for participating in the survey. We likely will do another one again as we move forward and as we possibly move towards a second wave of the virus. This is really a good measure for us to see what's happening in the community, and it allows us, as I said, to make important decisions. So thank you again for your participation, and we'll be seeing you next week. Have a good weekend. Thanks.
Good afternoon, Kahnawake. Just a quick review for the week that was. First and foremost, it's important to note that the task force is seriously monitoring the situation that's happening in the United States. Many people may not be aware, but many of the states that have previously opened have now found it necessary to scale back and are going to a more restrictive stance in terms of public gatherings. Naturally, the task force is going to be watching that very closely and always looking for what the implications will be. So we've moved towards the phase 2 of the openings, and by all accounts, things are going relatively well. We've lowered some of the restrictions for travel, but once again, anybody going or to or coming from the states has to self-isolate, especially what's going on in recent days. Just to note that the yard sales are now allowed, and dine-in restaurants are also being permitted. Naturally, the dine-in restaurant, somebody asked, do the cooks and staff working in the restaurants need to be tested before they go back to work? We're still under the past protocol where only people who have symptoms are required to get tested. Minister Legault has mentioned that this may change, but the hospital is waiting for official information or official direction. But at the current time, only people who are showing symptoms have to be tested. Having said that, the dine-in restaurants, all of them were inspected. All the restaurants were inspected when they were able to do takeout food, and if they wish to do dine-in, they would be required to get a second inspection to ensure that their physical distancing and their procedures in the restaurant are up to the standards. So if you're going to go to a dine-in restaurant, it's important that you always take the good precautions, and it is your right to ask the restaurant, have they been inspected? And if they've been inspected, they will have a certificate. And of course, if people don't feel safe,
they always have the opportunity not to go. Just a reminder that wherever you go, and this includes yard sales, you need to be very aware of the physical practices, safe practices. You need to wash your hands consistently, and when possible or within the 6 feet, you should be wearing a mask. There's a lot of information available on the hospital website. We always encourage people to visit that. Coming up in the next few weeks, we're going to give the version 2A, as we call it, of phase 2A. But towards the end of the month, we are looking at the bars and outdoor gyms possibly opening. The inspectors are busy working with the different organizations, and we know they'll continue to do a very thorough job. This is a holiday weekend. We really want people to take the time to enjoy. There is a high heat weekend, so we would ask people to be vigilant about the high heat, checking on elders and vulnerable people, and just to make you aware that even though it is a holiday weekend, the task force does have people on call all weekend. And with that, we'd like to say, Kahnawake, you're doing great. Keep up the good work. Have a good weekend, and we'll see you, I believe, on Tuesday. Take care.
Thank you very much, Arnold. And yes, absolutely, it will be Tuesday. Some programming notes. If you've been watching this program every day, we announced a few weeks ago that we'd be, instead of 7 days a week, we went to 5 days a week. And now, because the news is kind of spread out and we're all a lot more familiar with COVID-19, we're, as of next week, going on Tuesdays and Thursdays. If there is any sort of an emergency or a real need to go on more often than that, we will do so. So we'd like to thank everybody who's been watching all through these weeks and staying safe as much as possible. We have done very well, as Arnold said. For those people who are feeling stressed, we mentioned this a few times on the program, there is stress out there. It's tough for some people. If you're having any issue at all, contact Sigottiat Agentas Community Services and they'll put you in touch with somebody you can talk to. You can call them anytime during the regular business hours at 450-632-6880. But they do have people standing by at all times. You would call the peacekeepers and they'll patch you through. Peacekeepers number is 450-632-6505. Just one little update, if you're a big lacrosse fan, we have a lot of players out there. As of next week, looks like the outdoor rink next to Orville Stand-Up Park will be opening up. It's just about ready to go. There was a press release issued today to explain the circumstances. Once the signage is up, then you can play. And again, all of the rules are in place, such as the social distancing. Please wash your hands when you're going onto the rink and coming off. And also, there will be no contact. So basically, you can do individual drills, you can practice shooting on the goalie, but no contact drills and certainly no scrimmages at this time. And we trust that everybody understands exactly why. So we will take a break for this next few days, and hopefully everybody does have a safe, long weekend. We thank you for taking the time to join us, and we hope that we've been helpful. So on behalf of all of us here at the COVID-19 Task Force, Niawakoa Dano, Monigiwahi.